I have been blessed also with incredible bosses over the years. I've worked with some great leaders. I've always been relatively flexible in my schedule, and been able to figure out that work-life balance. But I think one of the things that I've always tried to do is make each person feel like, again, this is not Jen buying 7 Mercedes in a beach house. I mean, we are all in this practice together, and we have generous bonus programs and generous perks, which includes us basically being their primary care provider, so free health care, that in the past wasn't offered if I was going to be in a traditional setting. You would just be another patient, for example. And we've taken care of our staff and our staff's family members, and even extended family members. I mean, it's very, very rare that they'll hear me say, well, they're not a patient here. We take care of each other, not only on a personal level, but also on a professional level too. But again, it goes back to, I'm not naive enough to think I could do this by myself. And that's really what I try to preach, is that, I appreciate you. I appreciate the staff that I've had over the years. It's not just my current staff, but I've had many staff that we're a family, and we, help each other, and we provide for each other. And, somebody's car's broken down, and you loan them a car, or you go pick them up, or you take them home. And, your kids, I mean, Vance has been picked up, by everybody at some point or another. So you become a family. I think that's important. And I really think in today's workforce that's missing. I think if you're working in an office anywhere and nobody cares about each other, you're gonna have a lot more unhappiness as a staff in general. And then I think, again, I've never been a provider that feels like I'm above anybody that's not a provider. I feel like we're all equally as important. I may have the degree, but my job is to take care of patients. But everybody else has a job, and it's equally important. If the patients don't get scheduled by the scheduler, I don't have any patients to see. It's the same kind of thing. It's like we're all equally as important. We just have different jobs.